failure is a heart condition that's generally classified by, for some reason, the main pumping function of the heart has become reduced. The other thing that people often classify in congestive heart failure is if the heart does not relax appropriately. People also consider that kind of in the same category.
What are the symptoms that you should be watching out for?
The number one is shortness of breath. That's the number one symptom people come in complaining of. Swelling in your legs, chronic fatigue, dizziness and lightheadedness. And then congestive heart failure can also lead to a lot of conditions. It can cause things like your heart running fast and some other issues like that.
Are there any risk factors or some people more at risk than others?
As you get older in life, you're more likely to develop blockage in the arteries in your heart. That's the number one cause for congestive heart failure. So as you age, you are more likely to get congestive heart failure from that source.
What treatment options are available?
If it's being caused by blockage in the circulation in your heart, then we try to improve the circulation in your heart, either with stents or bypass surgery. And then once the circulation improves, the muscle all of a sudden feels better because it's got good blood flow, and so the pumping function of your heart can often return to even near normal. There are even certain types of pacemakers that we use that can help resynchronize the heart and help it work better with itself, and over time that can improve the pumping function of someone's heart.